Hi everyone, let's talk about the lateral rotators of the thigh. Now to begin with, this diagram is going to represent a posterior view of the hip joint. We have the sacrum, the coccyx over here, the ilium represented in pink, the ischium represented in purple, and the pubis represented in blue. Some bony landmarks to be familiar with are the ischial tuberosity and the ischial spine, as well as the intertrochanteric crest between the greater trochanter of the femur and the lesser trochanter of the femur. Now, to talk about the origins and insertions of the lateral rotators of the thigh, I always like to start off with the Quadratus femoris. So our Quadratus femoris muscle will originate from the lateral aspect of the ischial tuberosity, and if we just orientate the diagram, this here will be the most lateral aspect, and this here will be medial. So we have the Quadratus femoris muscle coming from that lateral aspect of the ischial tuberosity and inserting into that quadrate tubercle found on the intertrochanteric crest. So that's our Quadratus femoris muscle done. Next up, we have the inferior gemellas muscle, which will originate from the superior aspect of the ischial tuberosity, and it will insert on the medial aspect of the greater trochanter, like so. So that's done. And next up, we have the Obturator internis muscle. So our Obturator internis muscle will originate from the internal aspect of the obturator membrane and the obturator canal, or the obturator foramen rather, and it will insert as well on that medial surface of the greater trochanter. But by the time it gets to that greater trochanter, it's mostly the tendon of the Obturator internis that we'll be able to see. Next is our superior gemellas. This muscle is going to originate superiorly to the inferior gemellas, so it has to come from a higher point, and this higher point is going to be that ischial spine, and this will also insert on the medial surface of the greater trochanter. Lastly, we have the piriformis muscle, and our piriformis muscle is going to originate from the anterior surface of the sacrum. So I'll put it in highlighter here to demonstrate that it's coming from the anterior surface of the sacrum, and then the insertion will be the superior aspect of the greater trochanter. And those are the lateral rotators of the thigh.